I'm Dr. Abhijit Das, consultant in the Department of Thoracic Surgical Oncology at Apollo Proton Cancer Centre, Chennai. Thoracic surgery at one point of time used to be mostly open surgeries. From that ages, we have now come to minimal invasive surgery, where we do by video assisted thoracic surgery, where we have specialized instruments and that is used to enter the thoracic cavity and to perform the surgery. That has also made a lot of changes from multiportal video assisted thoracic surgery to uniportal thoracic surgery, where a single port is used to perform the surgery and deliver the specimen. And now we have something known as robotic assisted thoracic surgery, where the robotic system is used to perform similar surgeries with less trauma to the normal organs. With the advent of minimal invasive surgery, which has become a integral part of thoracic surgical oncology nowadays, not just in India but all over the place, I think we need to have more and more training specifically pointed towards the minimal invasive surgical part in India. And from the cost point of view, I think more and more insurance companies that are there in India needs to accept robotic surgery as a integral part of oncology management, and that has to be incorporated into their planning, which will obviously help the patients to get the most modern technologies or the most modern treatment facilities that are available right now in India. See, in Apollo Proton Cancer Centers, the first thing that makes us different from most of the places in India, that we have a cancer specific, site specific cancer management team. Whereas we, being the part of the thoracic oncology team, we have our dedicated medical oncologist, radiation oncologist, and we, being the surgical oncologist, who dedicatedly focus on thoracic oncology per se. We have most of the modern technologies available to us at our disposal for the management of the patients, ranging from video assisted thoracic surgery to robotic assisted thoracic surgeries, and we perform newer technologies like high-top for thoracic malignancies, be it primary or secondary. And Apollo Proton Cancer Centre is one of the best platform to have, where we can do more and more innovations which will help our patients in the future. Recently in Apollo Proton Cancer Centre, we have done high-top procedure in an adolescent patient. Normally we perform high-top procedure, which is like hyperthermic intrathoracic chemotherapy, which is done for malignancies involving the pleura, the pleural layer in the thoracic cavity, may be primary pleural malignancy or secondary pleural deposits. We have done few cases in adults. This was an exclusive patient of 15 to 16-year-old age group, where he has been told that that's the end of the treatment and nothing more can be done. So talking with the patient and the patient's family, they decided that they want to go forward with the newer modality of treatment. And so we also planned at Apollo Proton Cancer Centre to proceed with the treatment of high-top in his case, wherein he was suffering from Ewing sarcoma, where multiple lines of management has been done and he had 3 recurrences. And in this procedure, we first primarily removed the tumor which was arising from the pleural layer over the pericardium on the left side, and then intraoperative hyperthermic chemotherapy was done. And right now, down the line more than 1 year, the patient is doing well without any recurrence in disease, and he has gone back to school. So what we would like to convey is that this is a procedure which normally we perform in adults, but after taking the proper consent from the family, explaining them the pros and cons of everything, they decided to proceed with the procedure in a patient who was around 16 years age. And that's how in Apollo Proton I feel we need 3 things to have any modern innovation. First the platform of the hospital which is agreeing to perform such surgeries. Second, the most important thing, the patient has to agree, and they are the second pillar. And thirdly, we as clinicians who are ready to take the risk and the challenge to perform such things, so that we have newer guidelines which we can incorporate in our management.